So integrations have and will continue to be an integral part of patient care, safety, and clinical workflow. GuardRFID is partnered today with two of our valued integration partners, BBraun Medical and Connexall. BBraun is one of the world's leading providers and manufacturers of healthcare solutions, providing a product range comprising of nearly 5,000 products. Connexall is an enterprise-grade communication and control platform, delivers hospital-wide interoperability to people, systems, tasks, and devices. And here at GuardRFID, we're focused on real-time location systems, RTLS, driving the next generation of security applications in healthcare environments. Today, we're going to be discussing the importance of integrations, some best practices, and also the future of a smart hospital. Joining me today are the following panelists. We have Carrie Brock, our Chief Revenue Officer for GuardRFID, who will be today's moderator and presenter. Marek Dukajewicz, VP of Technology and Product Strategy for GuardRFID. Mindy Lowe, Product Director for Infusion Software and Connectivity for BBraun Medical. And Yihan Zhang, VP of Solutions Engineering and Pre-Sales for Connexall. So with that in mind, I'd like to thank you again for joining, and I'll pass it over to Carrie.
Thanks, Brock. I'm going to thank you to the panelists joining us today. These are two of our partners and my colleague Marek, and we look forward to spending this time with you and appreciate any questions you have. As Brock mentioned, just pop those into the chat box and we'll get to those. But we will kick things off and talking about why integration and interoperability is so important. And hospitals face several challenges, never more than they are now with the current pandemic situation. Some of the challenges, we're going to ask our panelists where they see some of the challenges in the hospital space, and maybe I'll start with Mindy on this. Unmute, Mindy. That is the new phrase of 2020. I don't know how many times we're going to say that, but if somebody said, what's the phrase that sums up 2020? And it would be, I think you're on mute. So there we go.
Yeah, there we go.
So welcome.
Yeah, so I mean, some of the challenges that our users have seen is how do they avoid using too many PPEs? And so we've looked at integrations with RTLS as one of the possible solutions by being able to have both solutions communicating to each other and giving a location to where a pump is alarming. With that alarm information, the user can then prioritize their visits to the patient's room. So that's just one of the challenges we've experienced or that we're trying to help users with right now.
Thanks, Mindy. Sounds like her little one's in the background assisting her today. And hopefully my dog won't bark.
I lectured, it didn't work.
This is the new normal, no problem. Yihan, how about from your perspective and Connexall, where do you see some of the challenges that you're solving for staff in the hospitals?
Yeah, absolutely. So from a Connexall's perspective, as we are providing all the integrations to various systems at a hospital, provide this enterprise integration engine to allow for different workflows in different departments. What we see, one thing outstanding is absolutely as being there are different equipments and devices attached to the patient. There are excessive alarms that needs to get to the clinician's attention. So as being the integrator, once we have all these alarms, how can we selectively help the end user to be able to leverage the integration with the using the RTLS technology and be able to provide the alarms to the caregiver at the right time, at the right information. This is where we're actually looking at the RTLS and to be able to give the caregiver the capability. If you are in the same room as the patient that generates the, let's say, patient monitor alarms, so Connexall be able to leverage the RTLS information, knowing the clinician actually is in the room, and we can suppress or take a less intrusive way to notify the clinician. So this is where we combine different information from different systems and help to battle the alarm fatigue.
Okay, great, thank you. So I guess that also what Mindy shared with us at the very top of the nurse not requiring to change the PPE as frequently. So if they know, for example, that there is an alarm and they know what they're going in for, they know which pump is in that room, or they know what medication the patient is receiving, they can perhaps just go into that room once as opposed to multiple times, if I understood the interoperability correctly. And
Yes,
so,
that's exactly it. In a lot of times, what we see with our facilities is they may have a bag empty alarm associated with the infusion pump. It would be a shame to have to go in to check the pump just to see what that alarm is, and then come back and have to redon the PPEs. But with the dashboard that we have that the RTLS system can communicate with, giving a location, that way, when they're looking at the dashboard, they know exactly where the alarm is at. Then they can also see right next to the location is what that alarm is, and they can prioritize their trip between the patient's room and whatever else they may have to do, whether it's a supply cabinet or so on.
okay, excellent, thank you. Brock, can you go to the next slide? I'm going to get Merrick to share from his perspective some of the benefits with the RTLS solution integrated into things like Connexall and into BBraun.
Sure, and I saw a question came in about what is RTLS. In the industry, we love to throw these acronyms around. So it actually stands for Real-Time Locating Solution, or Real-Time Locating System. So, and as the slide does, it's a very good segue. Thanks for that question, Mike. It allows you to locate equipment, patients, and staff easily. So typically, the piece of equipment or the person has a tag that they are wearing on themselves, and the system allows the people to see where that person or piece of equipment is. That's often used in security applications where you may want to actually have a piece of equipment or a person more often that you don't want to leave a certain area. So integrations allow you to actually set that up such that if that tag and that person comes close to a doorway or an exitway or an elevator, it can actually lock out the elevator or lock out the door to prevent that person from leaving the facility. It can light up alarms and do things like that. These solutions are often, as I say, used for security and safety applications. They're sometimes used with sensors that can detect if somebody falls down or is incapacitated and generate an alarm and tell the appropriate personnel where that event has occurred. Back to you, Kerry.
Great, thank you, Merrick. So Brock, if you could advance the next slide, please. And I'll pass this back to Yihan. This is what we envision for the future of the connected hospital, and this is using RTLS. This is several different RTLS use cases, and I think she's going to highlight some of the more significant ones.
Absolutely. As we said, that there are so many different types of the RTLS use cases. Traditionally, it all comes from the staff duress, patient wandering, infant abduction prevention, and asset tracking. But what we're seeing is there are additional systems in the hospital, and the integration certainly should allow all these systems to be able to talk together, to leverage the data exchange with each other, and be able to create more different use cases and bring a smooth workflow to the healthcare industry. So there are so many different use cases that we list out here. But what we would like to bring to your attention is one is the medication disposal witness program. So this is where we have been working with a hospital in the West Coast. What they're asking is when the nurse in the medication room needs another RN to be able to witness the medication disposal. So very easily they can go out and press the nurse call button. However, when the nurse call button is triggered, traditionally you would notify all the RNs on the floor and to see who is available. Now, in order to reduce the unnecessary alarm, maybe some nurses are in the patient room assisting the patient, and you do want to get to the closest nurse. and who is not working in the patient room. So now Connexall integrates with the RTLS system, real-time knowing. First is who are the nurses on the floor, and the second is where their location. Then we do a real-time vector calculation to see the closest 3 nurses. That's what the hospital is asking for, the closest 3 nurses, and we'll be able to dispatch the notification only to those 3 nurses. And as they are moving, any additional escalations can be sent to different nurses based on their real-time location. So this is what we find out. The location of the staff, location of the event certainly plays an important role in the eventual workflow. If the staff trigger a staff duress alarm, so certainly you can notify the whole group of your responders, but how about send it to the closest staff who is around the incident area and be able to come to the help at the first time that's possible. So this is, again, like we said, integration, make the system available. Leverage the existing investment you have on the RTLS system, on the IV pumps, on the nurse call, and be able to combine all these together. So just going to highlight these 2, and if you're interested, we certainly can spend more time on the site to discuss about it. Thanks, back to you, Carrie.
Thanks, Ihan. A great use case, and we're going to get we'll get some examples of that in a few moments too from Mindy and how they've it's not only patient care but also the clinical staff. There's just so much demand on them, and that's gotten even more challenging for them in the current state. So being able to make their life easier and more efficient is great. And to turn it back over to Merrick and just to talk about how we see the partner ecosystem. I like the word Yihan used about this RTLS evolving. So it started out as being standalone RTLS systems to do things like patient wandering or staff duress. But now with this interoperability, we're giving a much more expanded use of your RTLS system. So maybe Merrick, you can take a bit of a deeper dive on that for us.
Yeah, so if you just turn your attention to the slide here, and let's look at the left-hand slide, the quote from a Gartner article, which is basically telling hospitals or informing the audience that hospitals are spending more and more attention on actually bringing their different information systems together. Often different facilities or different sections of the hospital have deployed different systems for different purposes. And you'll end up with a security solution that's being used for security purposes. You might have a nurse call solution that's being used by nursing staff for very similar types of applications. Some sort of alarm goes off and the security people are being notified on their security or video system. The nursing staff are being notified on their nurse call system, and people are then using their phones to call between each other to figure out what's going on. And there is a much better way of doing it. And that better way is even amplified by actually putting in place an RTLS system. And often that RTLS system is there already, so it might just be a case of integrating it with the other pieces of the puzzle. On the right-hand side, the graph or the chart there shows you the different types of integrations we typically come across in our applications with healthcare providers. A big one that we haven't spoken to yet is video management systems. Those are often an integral part of the security system. And if somebody calls for help using one of our push buttons on their staff duress solution, wouldn't it be nice if the video camera could automatically swing around and look at that particular location so that the security staff or the management could see what's going on? Maybe it was a false alarm, but maybe there's something that needs to be reacted to really, really urgently. So integrating those pieces together can help make it much easier for the staff to give the right attention to the right people at the right time. Back to you, Kerry.
Thanks, Merrick. So let's talk a little bit about some best practices. If you are going to look, you either have an existing RTLS system or you're considering the investment in one. You may be looking at some of the other systems that you have, other technologies in your hospital today. So I'd like to open it back up to the panel. We've put a few tips on here. And I think one of the most important ones is this defining the use case up front. And Yihan, maybe you can give us a little bit of insight in why you think that's important.
Yeah, I think like you said, that there are so many best practices that if we are going to talk about the integration, but absolutely the definition of the use cases is the most important. The reason for being that is the use case is essentially the end user workflow day to day. And from a technology perspective, as we are the technology company, we think technology can enable everything. But if from the end user workflow perspective, how many data entries and the user have to do in order to make this particular solution work? And how many times, what is the behavior when the event is triggered? How does the alert notification and the system behavior would need to go? That has to go through what we call the human factor analysis with all these workflow definition. For example, if you're integrate with a security system, like Merrick just indicated, security, building automation, and the RTLS system, there are so many different use cases. As being one extreme that we actually delivered before was to be able to provide the patient experience to the treatment room to give a patient a different ambient light, different temperature according to the patient profile, the music, the video projection, all customized to the patient. So this use case certainly is different requirement when it comes to the patient wondering that you need to obtain the alert and alarm and be able to send it to your security team. So in our mind, define the use case and actually talk to the end user to walk through the process will ensure the technology provides what it requires essentially to become a great project.
Thank you. And I guess the risk of not defining those use cases also becomes trying to do too many things with the technology and overwhelming the resources involved in the project. Mindy, from your perspective, what do you see from a company perspective where you provide medical equipment that's essential to the patient care? What are some of the best practices you recommend to the customers purchasing the BBraun infusion pumps and dose track?
Well, when they're looking at interoperability to go on top of those two products, we really want them to do a lot of research up front. We will assist with that, of course, but it's very important that they're speaking with all companies involved, whether it's just two parties or if there's maybe a third-party interface. And they need to be very clear with what their goals are. Now, some of what they need to do up front is just learn what the capabilities are. And we can assist them with the use cases that we've defined. But then we also rely heavily on our customers to say what else they want to do with it. So when we start going down a project, we're looking at things like the infrastructure, whether they're properly set up to do what they want to do. We'll need to do assessments of their wireless network. If it's with an RTLS, refer them to the RTLS vendor to make sure they have everything in place from the RTLS infrastructure. Previously, it was not very common to put RTLS tags on pumps. And this was because knowing where a pump was located had a tendency to not be as important if you didn't know what the pump was doing. So, if you knew a pump was in use, it didn't necessarily get you what you needed. But now with this integration, we're able to show both where the pump is located and what it's doing, which has a myriad of benefits to the user depending on what their goals are. So we really want to make sure we have a very clear scope of what the project is. And then also working with those customers to understand that interoperability usually means having a multi-company team involved with the integration, and that is most likely going to be a long-term team that is working together. I don't know of any integrations that are 100% plug and play They all either require finessing, or the teams using those systems on a regular basis to meet the goals that they're after, and also discover what else they can do with it.
Great. And I think that's just such an evolution, like, I bring that word back up again, but from being able to track where pumps were, well, from a clinical perspective and their workflow, knowing that the pump is available, that it's been maintained and it's not in use with another patient, just saves so much time. Now I'm going to get a pump as that the clinical staff, and I can take that to my patient and I know I can use it. That's just fantastic. So that's a great example of evolving in that interoperability. And maybe what I'll do, Merrick, just before we jump to that, we'll talk about some of these integration considerations. One of the last bullets on that best practices was the accuracy. So when selecting the RTLS system, Merrick, from your perspective, maybe just a couple thoughts on that.
Yeah, so, RTLS systems use RF communications to figure out where the tag is, which tells you where the piece of equipment or the person is. And it would be nice if it told you within a centimeter cubed exactly where the person was or the equipment was. But more realistically, you're going to get, with the basics of how it works, you're going to get about a 10 to 15 or 3 to 4 meter accuracy, which could mean you're in the room next door to where the system thinks you are, or it could mean you're on the floor above where the system thinks you are. So we have actually secondary devices that we put in place at stairwells and at room entry and exit points so that we can actually home people into a particular room and determine which floor they're on. But as you add more of that infrastructure to do that more accurately, it does increase the cost. So it's important when you're designing and deciding on the RTLS system that you have a good idea of what your use case demands. If you've got a big open ward in a hospital, it's probably good enough that you can actually see 10 to 15 feet, you're going to be able to see somebody in trouble. But if you've got 25 different rooms where people might be in trouble, it's important to have that actual room level location. So be aware of what the RTLS system is capable of doing in a realistic fashion from accuracy, and make sure that you design the system so that it meets your particular use case needs. Back to that point that Ihan mentioned about, it's very important to make sure you've got your use cases defined and that the technology can deliver what you need.
Perfect, thank you. And I think what Mindy was saying as well about not having to continuously change your PPE as the nurses go in and out of rooms, if they only need to go in one time. And so if you can give them that room level accuracy, whether it's canceling alarms through the Connexall system or whether it's locating a pump, a BBraun infusion pump, that room level accuracy could be very important to the efficiency of the workflow. So thank you for that. We're going to jump over now to considerations on these integrations and interoperability. Maybe just at a high level, what's important when I look at, there's several standards here. How do we know what to do here? Maybe Yihan, you've got some technical background, you can share with us your theory.
Yes, so this is actually Connexall has been doing every single day. It is our mandate to integrate with different systems that currently is in the hospital. Either is being recently acquired, has pretty much a very, I would say, modern protocols and technology supported, or we also have to look at hospitals have systems that currently in the hospital for 10, 20 years. And in future, this is where I guess every hospital is being thinking where the future technology goes and what protocol, what system can we use or can we expect 10 years, 5 years, 10 years down the road. So for Connexall, we provide this integration platform that is open to almost every single system in the hospital, that we have to work with the technologies that's very proprietary. They have their own API that be able to provide the data for alarms, events, and information. And also we have a company who support like a GuardRFID open standard like a HL7 IHE PCD, and so on and so forth. So Connexall does integrate with different protocols, either proprietary or standard. But in our mind, of course, standard is way easier as I compare to, define every single individual integrations using the proprietary API. But realistically, what we found is a lot of times the proprietary API actually contains way more information due to the industrial standard may not consider a certain use cases, the way of using the data, the frequency and the way of carrying the data. So with the GuardRFID, we actually evaluate both APIs. We actually finally choose the RESTful API, and it provides us so much information rich that we can define the integration not only for 1-2 customers, but even for more customers who may not even think about the workflow and the use cases, but we have all the building blocks ready. So in future, when there is a project, there is a likelihood of being very little or to no R&D required, but be able to leverage the existing integration building blocks and be able to create all the use cases and the workflow hospital requires. So yeah, back to the question, what type of the API is the best? I would say really depends on the system, depends on the use case. But as for Connexall, we're open to all of them.
Okay, but ideally, you would say standardizing the standards would be nice, is that you would have everybody writing to the IHE. Second easiest becomes a RESTful API, but you're saying because of the legacy information or data that's in a particular system, that proprietary API that they created probably originally may contain data points that your endpoints that you need for your.
Yeah, that's right. This is where we say need to standardize the standard, as IHE still has a different variations. Every system or the alarm system company using the standard protocol, but there are some little tweak here and there in order to provide more easy integration, but that cost down the stream is you may not, as maybe originally said, is even though everybody are using HL7, but when you plug it in, a likelihood is not going to be 100%. The system will be working out from the from the first try. So standardize the standard, and the discussion amongst the integration companies is also very important.
Great, thank you. And Mindy, from the BBraun perspective, are you similar to Connexall, where you accept all different implementation options?
We actually try to standardize on the IHE open standards for the most part. However, we do take into consideration what's been being requested to see if it's something that we can work with. Right now, we've been pretty successful with doing all of our integrations using the IHE standards, but we are looking at a particular situation right now where those standards probably are not going to work, and we are going to have to come up with a different solution. So we're not opposed to looking at other options, but we do agree that standardizing those standards is the best route to move forward with.
It seems like as that's part of on that evolution of finding more systems to integrate or have that interoperability, standards for the standards and more use cases for the RTLS seem to be the direction we're seeing things going.
Right.
Merrick, before I move on to the next slide, was there anything that you wanted to add to that?
Actually, if you want to move on to the next slide, I can kind of add it on and dovetail into that slide. So,
okay.
So we've spoken quite a bit about the IHE as a standards body, and so maybe I should break out the acronym. So the acronym stands for Integrating the Healthcare Enterprise, and it is a non-profit group, and their job, or they have committees that actually define profiles, which is kind of the use cases, back to that earlier point about for different applications. And it then uses an underlying technology called HL7 for health level 7, if you really want to know your acronyms. That's the sort of alphabet, if you like. And then the IHE committees define the sentences about how you would actually communicate between devices. And a particular example of that is the integration that we have done with BBraun, where this diagram kind of illustrates that. Our server actually communicates to the BBraun server, which is keeping track of the pump status. And then separately, our infrastructure is telling you where the tag is located or where the device is located. And that server in the middle integrates those two together so that you can get a readout of, oh, I want to see all the infusion pumps that aren't in use, so that I might need to use it. Back to Mindy's point, it's all very well finding an infusion pump, but if somebody's using it, it's not very useful to you. You can also get alerts and alarms if they're actually needing service or out of IV fluid or whatever it might be. So that integration together between the two allows you to get much more intelligent information about the equipment you're tracking. And the IHE is doing a stellar job of bringing companies together to get those use cases defined and implemented. They have annual Connectathon events, very techie events, where all the engineers get together to verify that their different implementations actually work together. So it's definitely a call out to that group, and GuardRFID is a part of that organization. Back to you, Kerry.
Great, thank you. I think you or Mindy can speak to this as we talk about not just asset tracking, but smarter asset tracking. I think we've touched on this, but if there's anything you wanted to mention about the dose track system as well, Mindy, that's helpful to the audience.
Yeah, so we have about 3 different scenarios where we've been able to use RTLS integration to improve processes for our customers. One of which is mentioning the PPE reduction by being able to know what the alarm is and where the pump is alarming before you go into the patient's room. Other situations, we've had a particular hospital that implemented their RTLS system with their pumps after their way of managing their fleet before this was to have nurses walk the floors twice a week and count the pumps that were in use. This was to manage the PAR levels that they kept of pumps in each unit. But now, of course, with the RTLS integration, they were able to remove the nurses from that process. And it's easy to run a simple report that will show them exactly where every pump is at, whether it's in use or not. In some cases, you can get down to the level of information as to whether it's in quarantine or being cleaned, or if it's on battery power or on electrical power, which brings me to another use case where we have in the pump world, that when you're doing a drug library update to a smart pump, it can take months to find all of those pumps and get them cycled, power cycled to the point where the drug library can be updated. However, with our pump is able to be updated with just by being plugged in. And so using the RTLS system, either the pharmacy or biomed, whoever's responsible for sending out that drug library, can take a look to see if all of the pumps are plugged in. If they see pumps that are not, and those pumps are also not in use, then pumps in and then send out the drug library. And we've seen customers that have been able to reduce their drug library upload time to just a matter of a few days, rather than it taking several months to actually accomplish this. So there's a lot of different ways to be able to use the RTLS integration when it comes to the infusion pumps.
And I wonder if the evolution of this, it was something I was just thinking about this morning as I was reflecting, getting ready for this webinar, was if the patient was tagged, if the pump was tagged, if the clinical staff was tagged, then, would you have also that ability, just in case the wrong medicine or the wrong piece of equipment is with the wrong patient, is there the potential for preventing a mix-up or an accident, or if a pump, goes out of use and it's critical to that patient, then you can capture that alarm, and then the Connexall system is also monitoring these things, or the AllGuard system.
Yeah, there's definitely potential for that. And we actually, within one of our systems, a use case that we promote is that using our real-time status view in the dose track software, by having the integration with an RTLS system and knowing exactly where that pump is located, our dose track software will highlight infusions that are running above the soft minimums or soft limits that are associated with the drugs, particular drugs. And, those limits are set trying to prevent catastrophic error. But if they're above a soft limit, it may not be an error that it's actually running at that, or it might. And so with our dose track software, you can identify, here's a pump that's running above a limit. And with the location, you'll then know, should that pump be there at that limit, maybe I need to go catch it, double check what's happening there and fix that. I do think that interoperability in general is going to expand beyond that simple use case, and could include things like Connexall and being able to have more of a almost an artificial intelligence kind of realm, where you can have an alarm that's sent to the clinician saying you need to go check on this particular one, or even turning the pump off remotely, saying that this is a problem, something is not accurate here.
Excellent.
But that's not our technology for today. That's future.
For the future, but we also have seen use cases where hospitals are now starting to look at tagging patients coming into the emergency departments, because there's so many things that could be going on with that patient, and sometimes a patient will leave and they haven't fully taken care of them, and you get a wandering patient. But from an ER where you used to only see that in behavioral health, so we're starting to see evolutions of patient safety and patient care, but also trying to locate equipment in a busy, chaotic ER. And right now with COVID, the patients can't come in often with a loved one or someone with them. And so now, when in the past they often asked you, keep your eye on them and come and get us if something else, the person that came in with the patient was often part of the care, the chain of sort of care for this patient, and you just can't do that these days. So we're seeing, maybe technology being leveraged more. Thank you.
So just one thing to touch on before you go from that slide. We've talked a lot about tags and things. I'd just like to point out that you can see there's a blue device attached to the actual pump enclosure, and there's also a blue device just attached to the bottom of each of those pumps. That's the actual tag, GuardRFID tag, that is used for this solution. And again, talking to future, wouldn't it be nice if that were actually built into the pump itself? But for now, we have low profile tags, which are double-sided taped to the actual device. They can include tamper detection, such that if they're removed maliciously, an alarm will sound. So that's just to give you an idea of the size and format of the technology that we're talking about.
And battery life for those tags, Merrick?
Yeah, it's somewhat dependent on use case. We do some things like we don't report as often when the tag is stationary, but typically you'll get 2 to 3 years out of a tag in this type of application.
So fairly low maintenance for the administration staff within the hospital. They don't need to be removed or charged or anything like that. With the active RFID, you've got quite a long battery life. So that's also a pro to the administration of the system. So thank you for that good tidbit to add in there. And Brock, you can move us ahead. So I don't know if we talked about standards getting more standardized, and I'm not sure if there's anything else, but where we think the future of them, where are we going to be in the next, I don't know, 3 to 5 years or 10 years out? Ihan, maybe from your perspective.
Yeah, actually, before we heading that direction, I do have one additional comment that just to add on to Mindy and Merrick's comment for not necessarily the prior slide, but just talking about artificial intelligence and compare data coming from different sources. We do actually have use cases talking about the patient got admitted to the patient monitor, but here you can talk about the patient as medication being administered by the IV pump. Now, patients themselves has the tag, and so now in the EMR system, also you have the patient that belongs to a particular location. So with all these information together, Connexall can use the what we call the data integrity kind of a check to be able to see, maybe we cannot define which system ultimately has is the source of the truth. So supposedly it would be the EMR system. But essentially, if you look at the patient who always associates with the pump has a different name on the tag as compared to the EMR system as a different than what has been sent through the IV pump, then there is potentially a patient safety issue. So these type of, I would call it more proactive data integrity check would be very useful and helpful to avoid any medication errors and possible harm to the patient. So I think that this is what we see going in the future. The integration and interoperability not only is it built based on, yes, X system can talk to Y and have an interface to the Z system. It is more talking about moving outside from the technology and looking at the interoperability. This is where the workflow, the use case coming from. Is the end user, the day-to-day, the nurse manager, and executives in the hospital, they will be able to define what exactly the technology should go to. No longer would be, let's say, tracking these, but based on the investment that the hospital has been done on the RTLS system, on the clinical system, and the integration, everybody would always ask, what can we do more with what we have today? What can we automate to ensure the process have less errors and more automated, save more time and overhead, and be able to have the time giving back to clinicians and to have them to spend time with the patient. And instead of finding, they always say, finding the doctors, finding the equipment, finding the nurses, finding the medications, and then finding who should they find in order to deliver the messages. So we always believe interoperability should always come first, then it will drive the industry to define the functionalities and the features on the integration side.
Well, maybe that's the key to this, is tag the doctors and then the nurses can find them. Maybe that's what we need. Okay, thank you for that. Yeah. I think we'd sell more systems if we advertise that as a feature. Okay, next slide, Brock, please. So Merrick, maybe you'd like to introduce this slide for us. Oh, and you, sir, are muted.
Sorry, I was typing something there. Yeah, so this again is an initiative that was led by the HIMSS organization. So HIMSS in March had created, and every year they create a bunch of showcases that show how the different technologies can work together to get a better integrated solution than the parts working alone. HIMSS was actually cancelled as a result of the COVID, but however, some of the organizations, and Getinge is the one that has made a video of this one, actually made some small videos of some of these scenarios, and I'll invite you to go and look at this after the call. So this one is a quiet ICU, so it's showing how you can reduce the number of alarms in an ICU, and alarms going off tend to be very frightening to family members in particular, and very disruptive to staff. So by having more intelligent routing of alarms, you can actually create a much better scenario. Now, somebody did point out to me in looking at this is very pre-COVID. So I think this is pre-COVID, and hopefully will be the situation 2 years from now. But there's a great lack of PPE in this actual scenario here. But you know, the fundamentals apply, and in fact are even more relevant. You know, now that staff are having to wear all sorts of PPE, it's much more difficult for them to perform some of the manual operations. So by having integrations to help with that, it is making their life a little more tolerable.
And obviously making an ICU quieter for the most critically gravely ill patients so that they can get more rest makes a lot of sense. So thank you for sharing that. So before we wrap it up, I was going to ask there wasn't a slide for it, but just a question to the panel. Do you think that COVID-19 and the pandemic has created more demand now for RTLS and interoperability in hospitals and improvements and efficiencies to workflow? So maybe Mindy, I'll start with you. You can unmute.
Yeah, so it definitely did for us. We've always had a demand for our dose track software, but without a location, unless you're talking about a very small facility, it doesn't necessarily give the detail they need to really address alarms that are occurring and trying to avoid multiple trips into a room. So that's been one way that it has definitely increased for us just during the pandemic.
Excellent. And Yihan?
Yeah, and also I think COVID pandemic gave us one big demand is to be able to reduce the unnecessary trip to the patient room and preserve PPEs, and but without compromising the patient safety. So the integration with the RTLS system, as well as IV pumps and the bedside system, to virtually extend the size of the room to the mobile device from the caregiver, so the caregiver can be notified at any time when the patient has a request or an issue. That will help them a lot. And I think one big thing is, if the clinician is in the isolation room, especially for COVID, and if other requirements coming into the clinician needs to take care of, with the RTLS integration, Connexall actually can intelligently reroute the alarms to the secondary or backup clinician, knowing the primary clinician in the room. It's very hard to change the PPEs and make him available to this alarm. So this is one big thing that we see recently. It is extend the alarm range, and without necessarily always have to go into the room and find out what's going on.
Thank you, Yihan. Merrick, I'll give you last word before we go to the questions.
Yeah, so one use case that's become more prominent for RTLS solutions with COVID is the fact that, due to COVID transmission characteristics, it's much more important now to sanitize rooms after they've been used and before they're used by somebody else. And I've heard reports of people that are doing that in a bit of an obtuse way. When a patient is discharged from the hospital, they then just batch somebody to go and actually clean the room. But that might take 30 minutes or an hour to happen. Wouldn't it be better if we actually had some type of way of knowing with an RTLS tag when that patient and staff have vacated the room and it's empty, so that staff can be sent there immediately to clean it, and thus improving the usage and the turnaround time of getting a new patient in there. So there are lots of those kind of workflow things that can be improved by RTLS specifically, but secondly by the integration of the various healthcare systems.
Great, well, thank you for that. Let's just go over here to the questions in the chat. Can you also know where equipment has been at a certain time in the past? Is there traceability if there is a need to investigate a device or person? So Merrick, I think that one is, and I'll open it up to the panel, but certainly with RTLS, we have the breadcrumb capabilities? Maybe you'd like to explain
Yeah,
that further.
typically our tags are reporting their location every 12 seconds, and that's all stored up in a giant database. So if you do actually find that a piece of equipment has gone missing, for example, you can watch it go down a hallway and out a door. You might be able to track who was close to it at that time if they were also located with the device. And as Kerry referred to, that's a breadcrumb trail, but also you can generate reports that show you, allow you to draw a map of where something or somebody has moved during the day.
Excellent. We've got another question about what is the concept of a smart hospital? And we hear that sometimes we hear the terms also like a smart city. So in your perspective, Mindy, what is the smart hospital in your mind?
Well, in my mind, it means they have multiple integrations that have occurred, multiple interoperability. But I know with a lot of the customers we talk to, they think they're a smart hospital if all they've done is integrate their EMR system with one or two different things.
Okay.
But when I look at a smart hospital, I'm thinking you need to have a lot more going on than just your EMR. You need to have an RTLS, you need to have an alarm system. There probably needs to be some patient monitoring that's occurring between devices rather than just the EMR. But your EMR in a lot of cases may be the foundation for other integrations, other interoperability. I know for some of the integrations that we do, we actually rely on information that is shared between the EMR contributing to other separate integration. In alarm management cases, a lot of time we need to get the patient information through the EMR integration for the alarm information to then transfer between devices. So that's really when I start looking at a smart hospital, is they've got multiple integrations going on and they're looking at other ways to use those as well.
Okay. And Yihan, you mentioned something about the patient and in the room, and I thought that was interesting to get your perspective on the smart hospital. But you mentioned like the ambient lighting, temperature, sounds, music, those kind of things for the patient environment. Is that something you see as part of this evolution of a smart or more the hospital of the future?
Yeah, absolutely. I think there are lots of different definitions of the smart hospital in future. But I think the one thing everybody agree, it will become a digital hospital, meaning all the systems will need to connect together, sharing the data, and be able to enable the interoperability for use cases. And what we're seeing is, in future, not only hospital is responsible for keeping the patient, but also make their journey in the hospital more personable and more comfortable. So, but having different alarm sound that's more soothing, having the patient profile can be defined. For example, like we said, if you're in the patient room or you're in a chemotherapy room, we have done this with vendors 10 years ago, actually. When you're in a chemotherapy room, you have to spend an hour over there. So what can hospital and technology to make it a better experience for you? So giving you the soothing sound that's of your choice, not just by picking by anyone else. And then you would love to have a more warm light, ambient light, and you want your temperature being setting to 75 degrees or 23 Celsius, as well as I would love to see the ocean projection. So all these can bring a little bit of a personalized experience for the patient, just like a precision medicine. Everything is targeted towards the patient and be able to speed up the patient healing process. So we think a smart hospital is by utilizing the smart technologies, like connecting the Internet of Things with every technology together. But at the end, it is not technology dominant, but it is the use case workflow interoperability that would require and demand how the system would need to connect to each other.
And it sounds like, Merrick, we'll get your thoughts on the smart hospital, but it sounds like the smart hospital is putting the patient and the staff working there, so the people first, and the benefit of this is you will also get efficiencies and savings and maximize your investment in your technology. Would that be fair to say?
So yeah, you want to hand over to me?
Sure.
So I think we've spoken so far about patients and staff, but an important third element of hospitals is visitors or family members that are going there. And hospitals are typically a scary place to visit because you're going to see somebody that's ill or unwell. They're also often very confusing places. There are loads of corridors that lead often with colored lines on the floor to try and tell you where to go. And then you sit in a waiting room for 30 minutes wondering what the heck's going on. So there's definitely opportunity there to get a much better experience for the visitor, both allowing them to find their way to the place they're going quickly, as well as getting them more up-to-date and timely information on the patient that they're coming to visit.
Right. Well, thank you very much. On that note, we've answered all the questions in the chat, and we are coming up on the hour. So I'd like to thank all the attendees today, my colleagues, and the panelists. Thank you so much for your time. Brock will be posting a recording of this in the next probably 24 hours. And then feel free to, we'll share contact information. So if you've got questions for BBraun or Connexall or for GuardRFID, we'd love to hear from you. And thanks, and have a great rest of your day.